So we're doing NUR203 week 3. We're going to be going over school age, going to go over adolescents. Now I teach differently than other people's teach than Professor Morris, but I'm going to teach with a PowerPoint. At any time you see anything that you don't understand or you need further explanation, please don't hesitate to stop me and ask a question, because I'm sure somebody else has the same question and I don't get upset by you stopping me. In fact, I encourage you, please stop me. We're going to be doing the PowerPoint and we're going to be doing a little differently than I usually teach. Do a PowerPoint and do a Kahoots on school age. Then we're going to do a PowerPoint on adolescents and then do a Kahoot on adolescents. I was told by a student from last term, she says, that PowerPoint goes on forever and then the Kahoot is so big, I don't feel I'm learning. Can you break it up? And I said, gee, well, we've got chapters. Let's break it up by chapters. And that's what I've been doing. And which means extra work for me, redoing everything. But I'm getting such good feedback from it. So I will continue and I will get it done like that. So today we're going to be starting out with school age. Remember, this week is week 3. You do have your NCLEX questions. Be careful. They're not just pediatric questions. They're growth and development. If you try to put growth and development pediatrics, you get like 10 or 12 questions. You must go to that other topic, not pediatrics, but that growth and development. And if you don't do it properly, we're going to send it back for you to get us back what we're looking for. Next week, we do have exam 1. This week, we are running exam views all week long. I've already done mine. It's already posted. If Professor Morris's class doesn't realize, I do have a YouTube channel. It is Professor Bogart Pediatric Nursing, and I have like 5 years of recordings there. You can go back and listen to anything. Things change a little bit, but not much. Concepts are still concepts all the way through. So it's always there available for you. As we get these reviews, we will be posting them. Now, tomorrow, Professor Morris was supposed to be doing hers. She's already said she's not going to be able to. I've told her, please give me the recording from last term, and we'll post you one of hers, because she does very detailed go through things, and I think she is a really good person to listen to go through all of the details she does. And then listen to me and listen to all the explanations that go along with it, right? And between those two, you all should do well. Any questions about anything so far? All right, let's go ahead and start with our first half of our PowerPoint, and we're going to be starting out with school-age children. School-age children, fun ages. When I did my dissertation, I did it on school-age children. School-age children are extremely teachable. They love to learn. And what have we learned about them? They love to please. So when you're teaching them about things like diet and safety and water safety, these are things that they will listen to and they will learn from it. So school-age children, really neat group of kids. Ages 6 to 12. This is such a variety of a child up to almost an adult, right? So when you're talking school age, remember, look at the child, see what age they are. They're going through so much changes now. A 9-year-old could look like a 15-year-old, and my grandson was that. He was 140 pounds and 5 foot tall at 9 pounds at 9 years old. But mentally, he was not older than 9 years old. So you really had to be careful, talking with him, because you thought he was a lot older just by a look, right? School age starts with the end of the baby teeth, and then they all fall out. And now we get all of our permanent teeth in. Through school age, we're now still slow and steady growth. There's nothing big, there's no spurts, it's just slow and steady. And through this, school age children now are getting that emotional maturity, but that's with age. So again, make sure that we're looking at them saying, all right, you look older, but emotionally you aren't. Through the whole thing, they gain a lot. 6 years is a lot of weight, height and weight to look at. So yeah, it looks like a lot of amounts, but it's just slow and steady. Boys and girls are about the same. We know that the body's getting longer and leaner and it's getting more graceful. It's not as awkward as it was. We know that again, faces are maturing. We're starting to look older. This is the age of all I want for Christmas is my two front teeth. I mean, I love this picture. It just really describes that 6, 7 year old with those front teeth coming out. But it's not just the teeth changing, the whole face. They're starting to grow up and start to mature. We've mentioned head circumference at birth is very large as comparison to the body, but it's one of those markers because we look at the head and we look at the chest because we know the head has to come out the birth canal first, right? So it has to be bigger. But then the chest is smaller, but by about a year, 15 months, head and chest are the same. So as we get older, there's really no relationship between head and chest, and that has gone away now. As a school age child, you're becoming more able to go on longer car trips, right? Because your bladder can hold a little bit more. When we look at the x-ray and we look at the heart relationship to the chest on a young infant, you're going to see it looks like the heart has the whole chest. As we get older, it's going to look about what it should be, a little heart and then the lungs, okay? It's going to look better. Immune system. Why do you think immune system is getting better? Well, look at all the immunizations we've given this child up to this point, and look at how many times this child's gotten sick. And every time they get sick, they're building up antigens, antibodies, protect themselves from future diseases of the same. Now, at birth, I've always said those scalps on those infants are soft, and we're worried about the flat head thing, and just a little tummy time can help that head, round out. And you're wondering, how can that be just a little tummy time? Well, I've always said the heads are soft, the bones are malleable. As we get older, now in school age, now they're hard. It's going to be harder to be able to mold them into something else. Instead of a flat head, they're going to have a flat head if they still have it at this point. Like I've said before, physical maturity does not necessarily correlate with emotional and social maturity. They can look like they're grown up, but it doesn't mean they're there. Okay. Another thing that we see in children in school age is they show stress differently. We know younger kids, oral, they self-soothe, those sort of things, and we know they regress, right? In sucking thumb and maybe bedwetting. As a child gets to be a school age child and we're seeing something's not right, it could be as a dog died, that their family dog died, or their grandma has moved away and they're not going to see her for a while. This is some stress that actually kids might hold. So how would they show that? A lot of them don't talk about it, or they don't know that this is bothering them. But all of a sudden, this is a kid who's never been sick, is now complaining of abdominal pains, tummy pains, wanting to go to the school nurse because they don't feel well. This is showing something abnormal. It also not only could be physical, it could be acting out. Where they've never been children who act out before. So now you've had a change in personality and a change in, their physical, they're not feeling well type thing. That's a child who's showing stress, distress, something's going on. Now, boys start puberty girls start about age 10 and boys are 2 years later, about age 12. We know that menses will start 2 years after puberty starts. What is puberty, right? It's the starting of the breast buds and the enlarged scrotal the large enlarged scrotum, excuse me. And those in the male and the female, we start seeing them. It's the beginning of that tanners, and we'll go on that in a second. Now, assessing a child who's a school age child. Remember, they're ages 6 to 12. What you would do to a 6-year-old is not what you would do for a 12-year-old. I have the example here of for an X-ray. Now think about little boys and all of these magic heroes and whatnot, and they're shooting things out of their wrists and they have gamma radiation rays and this, okay? School-age children, the younger ones, if you're saying you're sending them for an X-ray, they think something's going to zap them and zap a hole in them with this radiation gun. And they see this big machine, and it's when it's moving, it clink, clink, clinks like this big, robot. So it's scary. So before we send these children for an X-ray, let's break it down and make it easier. There's this big thing that looks really bad, but it's not going to touch you. It makes noise, but you're not going to feel it. And guess what? I'm going to show you your insides when you're done. Whether it's the broken bone or a pneumonia or whatever, even constipation, showing them all that stool in the bowel, I will show it to them. And if not, I've seen young boys especially react to that, going into that X-ray room and just turning around and running. Inspecting these children, it is this thing about children well appearing, sick appearing. So if you're well appearing, these kids awake, alert, eating, drinking, looking good, right? We can see them. Are they in pain? Are they breathing hard? Just by looking at these children. After we look and we get that quick peek, and that's probably the most way that I'll assess a child. I can see what's happening just by looking. But then I'll listen, I'll auscultate, percuss, and then I'll palpate. This is also over the abdomen, how I would look at that also. Lymph nodes on a child. When you go for your exams, they always feel your neck at the doctor's office for checkups. Well, if a doctor feels a lymph node, you're not well anymore. You're sick because lymph nodes are only enlarged when you are sick. So if you're healthy, shouldn't feel them. One of the tests we can do on a child, and I have a brand new grandson. He's just turned 6 months. And from the very beginning, I do this. I don't know why, but I do. I stick my tongue out. And this little baby, even about 2, 3 months, starts sticking his little tongue out at me. And I'm testing the hypoglossal nerve actually on him. You were taught this in health assessment, but we can actually, to a small child, even infants, you can get that test from them. Another thing with assessing children that's a little different is breath sounds. Think about children. They're always full of mucus, nasal mucus, right? They always sound junky in there. They don't blow their noses well, right? So when you're trying to assess breath sounds, first listen to the bronchial, which is all the upper airway. I always would take my stethoscope and listen to the sides of the neck, and you hear like all of this noise. If the child is able to, or if we need to suction, let's get that mucus out and then listen to what the sounds are, especially if it's respiratory distress and you really want to know, what do these breath sounds sound like, right? So upper airway is going to be like rhonchi and a lot of noise. But then you go down to the lower bases and you're going to hear just the air, clear breath sounds moving in and out. So don't be tricked by children with upper airway mucus to think that they've got bronchi in their lungs. Okay, this exam is pretty heavy on theorists. Freud. Freud is anything sexual. But then you get over here to school-age children, and their term, it's not oral, anal, or genital. It's not that, it's latency. Well, latency in Freud just means that children learn from each other and become friends, and they're usually same-sex peers. And this is where they start learning about other people and about other cultures and other ways of thinking, because now they have their friend, right? Their same-sex peer. Erikson is all about how a child reacts to people, psychosocial, people around them. What does Erikson say about school-age children? Well, they love to please and they love to do something well and they love to get that praise all about it. Whether it's you play the piano well, or you're the best speller in the class, or maybe you're the fastest runner, that gives them a sense of industry. Now, how do you understand what industry means? And I've got a jingle lingle for this. Think about an industry as a factory, and a factory produces a product, and they produce that product well. They're proud of their industry, their product, whether it's running, math, cooking, playing or organ, or singing. What do I do well? And that gives me that great, great feeling. And it's peer approval. It's always going to be about peers. Now, can we do everything well? No. Well, school age children have that, sense of industry where I feel great, but they can't do everything well. What if they are a slow runner and there they are in PE with all the rest of the kids and they're on a team and that kid just can't keep up because they're a slow runner. Come on, you're slow. Come on, let's move it. Well, how would that child feel? That child's going to feel inferior and feel less than because they can't do everything well. So I feel good. It's industry. Inferior, I can't do everything well. And that's Erickson. Piaget is all about thinking. So where did we start with thinking? Well, we came out, the baby came out, and they had to learn how to breathe. Then we put something in their mouth, and they had to suck, swallow, and breathe. And then they had a reflex, and they grabbed a rattle. And then all of a sudden, they moved the rattle. It made noise, and they go, "Ooh, I like that." And then they grasp the rattle, and they shake the rattle because, "Ooh, I like it." So you see, just by a reflex grasp, learning about their mouth, now the rattle falls in, and now they are sucking on that rattle because how do they explore the world? How do they relieve themselves of stress? In the mouth. So again, Piaget, we're up to the point here of thinking. So now we're into understanding. I can organize my closet, all short sleeve shirts, all long sleeve shirts, all turtlenecks, all collared shirts, or shorts and culottes and dresses. And I can organize things. We understand that thing. Another thing, they understand things like you have two glasses of 8 ounces, one's tall and thin, one's short and fat. Now, a younger kid would think the tall, thin glass was bigger, had more in it. The short one, and fat one, they're the same. It doesn't matter. A school age child would know that. A younger child would want to pick the long one. Another thing is taking and putting things on the table, and they're all mixed up. Does it matter if they're organized or if they're all mixed up? If there's still 10 pennies, there's still 10 pennies. They're understanding this thing. So again, thinking becomes more, but it's got to be concrete. They've got to be able to have seen it, done it, smelt it, and they can figure it out from there. They cannot, if they've never seen it before, do it. That's formal operations. That's adolescence. So here it's concrete. I had to see it, touch it, smell it to understand it. Okay? Piaget. That's describing all of these things, what I just said. Moral development. Now, Kohlberg. Kohlberg talks about morality, which is right and wrong. Infants don't know that yet. Toddlers only know about me, mine, mine. That's the id, right? Id, ego, superego. No, they're the id. I want it, it's mine. Now, we get over to preschoolers, and what is that? That is reward and punishment. And children of school age now will conform to please. They love to please. They're going to conform to whatever rules you want. And that is Kohlberg. Spirituality and children. Well, initially they only know who the family has introduced them to. And that's that concrete terms. They know if they've gone to church or if they know there's a Christmas tree or a Santa Claus or whatever represents whatever religion, whatever spirituality, right? So that's the concrete. See it, touch it, smell it. They know it. The thing about children at this age, they think that if they've done something wrong, God is punishing them. I've seen this a lot with actually when they come in and their appendix and they need to have surgery. And what I've actually used to get in the habit of doing, when you get a school age child in who comes in, we've ruled, yes, they have an appendix, yes, they're going to surgery. I always make sure that I sat down next to the child and said, do you realize you didn't do anything wrong for this to happen? Because remember, they think God has caused this, right? So I said, it's not that you hit your sister. It's not that you didn't do well on your test. It's just that little thing in your body said, I don't want to be here anymore. And you had nothing to do with it. Now, what else would I put on top of that? I'm going to make sure the surgeon puts an extra stitch so that none of your insides are going to come out and you're not going to bleed out. Nothing is going to fall out. And you realize I can watch these children just relax, like, oh, I've just relaxed their mind. That was their fears, and they didn't even know they had it. So if you want to work pediatrics, remember that. Carry on it, okay? Carry on my tradition. So, social children school age now are getting more into activities and clubs and sports clubs and 4-H and all different things, right? We know that clubs are same-sex peers, usually friends go together. Your discussion question was talking about having children influence another child. Is it good or it's bad? Well, it's part of that growing up period that Freud says they need, right? They need to have same sex peers. They need to talk about what's going on. And yes, one's going to influence the other. I'm not going to play soccer. I only want to play baseball. So they ended up doing baseball because they still want to be together. We know all of these clubs and whatnot, there can be dangerous because of bullying, and not only bullying, sometimes it's the sidelines that become the bullies too, the older adults a lot of times. So, and another thing about clubs and sports group, there's another adult now also involved in the child. So again, more people are influencing the child and the way they think, and introducing different cultures and beliefs, et cetera, et cetera. Through school age, they do promote that your parents need to be adults. They can't be your friend. They do need them to be there unobtrusively, to be listening what's going on, to be there to catch them if they fall, through all this bullying and all of this stuff that comes from all of these other influences. Now, play. We've talked about play. We've got toddler play, right? Parallel next to each other. And it's me, mine. I am not sharing. So, parallel play. And then we get a little bit older and we realize playing together can be fun. So, preschooler is associative play. And then we get up to school age children, which now they love to win, they love competition. So now that there's a goal, there is something that they are going to win, whether it's checkers and playing a game, or it's building the racetrack, or building a sandcastle, whatever it is, there's a goal. The thing about play and why it's so important is that we in life are going to have to work, and we need to follow that rules and what we have to do, and we have to learn to do it as a team by ourselves, and we need to feel good about it, right? So this has given us practice to get there. Children are starting to learn who they are, what they're good at. My 9-year-old grandson, Christian, that I've always talked about, he's amazing at an organ, and he's amazing at math, and he lets you know about it. And now he likes his hair gelled up and he thinks he looks really cute. It's all about the appearance and looking good. He doesn't want to now dress in awkward stuff that as a younger kid, they didn't care. Now they're starting to care. And again, those significant adults in those sports games, into Girl Scouts, after school clubs, they're again more adults putting influences on them. So one of the things they do talk about a lot is the hair, and the eyes, and the blue eyes, and the blonde hair, and the curly eyes. And again, they're just starting. Before this, they didn't realize any of it. They're starting to notice it. It's okay. They don't have any comment about it. They just know that it's different than them. School is a hard time in life for school age children. These children have been playing. Not so many have to sit and focus for long periods of time. So this is part of it. Also, now you've got how many other children and how many other cultures have now come into the classroom, and now you're going to be sharing that. So now it's all about all the values of the society, and all different cultures are going to be there. And it's actually, educating them just on society in itself. Peer relationships, increasingly important. What if they didn't know they did something wrong and they're feeling bad and they need to talk to someone, or they feel good and they want to talk to someone? Peers are always important. Nutrition, nutrition, nutrition. Is nutrition important for school age? Absolutely. And the other way it's really important is this is the age group to teach about nutrition and how to have good nutrition, right? We know that school age children eat a little bit of everything. They're not as picky. We're going to be teaching them. And this internet thing called My Plate is actually a good one. It shows the food groups and what they should eat. The thing is, not everybody can eat all those fresh fruits and vegetables because they're expensive. And it's not always possible. So again, trying to teach these children what we can do instead of those things. Obesity in children, and this is why we like to teach them, is getting to the epidemic proportions. And it's because of several factors. It's because of technology, of course, all of the games and, Minecraft. And I don't even know what the name of all these games are out there today, but children just can't get enough of it. So they're sitting and playing. They're not up and out and moving. Also, the other concern is what about the neighborhoods? It's not as safe as it used to be. I remember, and this is crazy, I'd leave the car keys in my ignition when I went to bed at night outside of my driveway where I grew up. You don't do that today. So, environment has changed. And again, that has changed why children don't go out as much, but it should be encouraged. What we know is that if we can get to these children as school age children, we can prevent things, because overweight children have increased risk of hypertension, diabetes, and high cholesterol. And that's because of those changes that you got in this body heavier and all the demands that you're making on the body. And if we can take care of it now as a school age child, we have saved this child who's going to be an adult a lot of problems in the future. One of the things that it's been said, we know that teaching early can help. We should teach as early as when mom's pregnant, getting good nutrition into newborns and through all the levels of school and children, the infants and the toddlers, and they should all be eating correctly. It affects all ethnic groups. There's not, one type. No, everybody's affected by obesity and all of these things. And we know that children, school age, is that prime area to teach that it will make a difference. One of the things that has been seen that children have always been said, sit there, finish your dinner before you get up, or you can't have dessert until you finish your dinner, right? So children are always made to finish their food. They don't think that you should do that, because what happens is they become adults that now can't leave food on their plate because they've been taught as a child to finish it all. It's one of the things, maybe. So school age children are now sleeping better. We know that the younger school age child will fight it. The older one knows that I need to get sleep and goes to bed. Exercise activity, we've talked about participation and all those concerns. And, all of the activity is dampered by all of the cell phones and all of the electronic devices that are out there today, and all that media. Now, dental health is important. Just think about it. 6 years old, you've gotten all your baby teeth, and they're all going to fall out, and all your permanent teeth are going to come in. So you are losing teeth during this whole thing. So this says here, losing teeth is a sign of poor dental health. Is it? No, because they're baby teeth. They're all expected to fall out. But you can have dental caries if you don't brush well enough. So good hygiene, brushing, and dental flossing is highly recommended. Another thing that happens with children, and I've seen quite a few in my career, it's children that have usually front tooth, not usually the bottom, usually the front tooth, and it comes out, the whole thing. I mean, if it's a baby tooth, I'm actually happy for the mother because the permanent tooth is going to come in anyway. But if it's a permanent tooth, it's more important that we treat it and we get it reimplanted as soon as we can. What they do is they take that tooth and they put it in cold milk, or saline is another one, but milk. Everybody has milk in the house usually. Put it in that and you get to the dentist or to an ER. I know the ER I worked had pediatric dentists on call, and we'd call them up. And what we would do is we put numbing cream on that gum of Let, or not necessarily an amyl, usually Let, lidocaine, epinephrine, tetracaine was the one. But there's all different names. It doesn't matter which one, as long as we get it good and numb. The dentist comes and takes the tooth and puts it and shoves it up in there and holds it tight. The child's placed on a soft diet. Many times it takes, and hopefully that permanent tooth is the one that gets put in and it keeps, because it's expensive to put in a permanent tooth. Sex education is normal curiosity. Again, there should be communication with parents. We can also recommend school nurses for this sort of thing. Nurses in sex education, if they're asking questions, you can answer them. I always say, you tell me what you know before I tell you what I know, because we know that children don't know everything about sex and sexuality, although they think they do sometimes, some of these school age children. But questions, answering them is not a problem. And then, of course, the parents should be encouraged. Now, my parents, I could never talk to my mother about this. And my daddy, he was too shy for that. So again, who was the other person to be a school nurse? It's better than, going to somebody else. Talking about school nurses got a great job. Any of you who have young children, you get off all the holidays with your children. I think that's great. And you're there at school. In fact, one of our professors is a school nurse, and she absolutely loves it. I think the hardest thing that happened was COVID, right? COVID came out, school nurses were frontline, and they had to figure out what to do with the children and everybody and to keep infection control. And they do quite a bit of that. Now, in any type of an exam, injury prevention, safety, infection control, you're always going to see something regarding it. So let's give you some injury things here. Remember, any age, infant to adults, the highest cause of severe injury, motor vehicles, whether in it, on it, or under it. I mean, I've seen toddlers ran over, preschoolers ran over by cars, backing up out of driveways. So yes, it is number one. As I said, children with stressful problems, right, school age, tend to act out, right? A risk factor for injuries, because they tend to do things they're not thinking about because they're so stressed out, they're looking for attention sometimes. You're going to have a higher level of injuries with that child with that stressful family. Rear seat till 13 years old. Booster seat, they should be till they're 8. and ATVs. Now, I live in Homestead. I live by the Everglades, so ATVs are very common down by me. It's not recommended for children under 16. They can't have the ability to figure out if something happened, what to do to get themselves out of a situation. So they figure an older child would be better. We also know safety equipment all the time, whatever it is. Bicycle helmets are always should always put on, and whatever other safety equipment that's appropriate for that sport. Families at this time is when they're younger, family was all a child had. So now they're into school age. And now beyond the family, we've got school, we've got the clubs, now we've got best friends, and we've got their families. And now, you're sort of looking back at all of this. And as I said, providing that unobtrusive support, just watching them, keeping the child safe. A common thing that happens with school age children is, and it's usually diagnosed then, is ADHD. ADHD is when a child can't sit for long periods of time. They're inattentive, hyperactive. They start something and they don't finish it and they move somewhere else. Now, many times these children are labeled as spoiled and they don't listen. And it's not necessarily that. As I've told my other classes, I had a best friend who was my boss. So she's a nurse in children with pediatrics. And she had a son who had ADHD, really bad ADHD. And she did everything with that child. That kid had no privileges at home, if you can imagine. But the school, when they brought her in, the school nurse, first thing they did was blamed her for letting the kid be so spoiled. And she lost it basically. But again, the point of the story is when you have a child with a condition, don't ever assume that the parent's done nothing. First of all, listen to what they've done and then together make a plan of care. Common childhood thing that can happen is enuresis or bedtime wetting. It could be a one time, only time, or it could be all the time, or it could suddenly happen. If we're seeing enuresis suddenly happen that's never happened before, there's usually a background problem. Why? Think about diseases that you will see maybe bedtime wetting. It could be diabetes mellitus, diabetes insipidus. It could be a urinary tract infection. So again, let's figure out what it is and what we need to do there. Acoparesis is basically when a child holds their stool, and it tends to, you get impacted and then a bunch comes around the impaction and it is, stooling into their clothes, into their underwear. A lot of times, children with constipation of any type, usually this is stress. This is usually something's going on in that child's life. We know children can hold their bowels. I've actually seen it held for 10 days. A child held their stool for 10 days. And when we did the x-ray, the whole ascending, descending, transverse colon was completely with stool in it. So if the child is holding this stool, what's the problem? We need behavior modification. What's going on? Why is that happening? What's causing it? And finding out the cause of it. Sure, we could give an enema and get rid of the impaction, but the child's going to continue to do it. And we do not like to give laxatives. We don't like to give repeated enemas to children. We just don't want to do that, because if we have to do that as a child, what's going to happen when they're 80 years old, right? It's going to be, you need a stick of dynamite at that point. So we don't overuse it as a child. So a child has an avulsed or knocked out tooth. The parents are reluctant to try to re-implant the tooth. Where should the tooth be placed for transport?
In cold milk.
B.
In cold milk. Yes, it is. Okay, we're going to go for our first Kahoot, and this is just on school age children. There we are. Took a lot of looking. Who wants to win today? Amber, are you going to win? Maybe. Michelle? Maybe. Terry? Erica wants to win. Brandy wants to win. How
I
about
don't
you,
know. I
Crystal?
think I might have a good shot.
There you go. All right, let's get going. School age children. According to Kohlberg's pre-conventional level of moral development, a preschooler who has moral reasoning, what do they know about morality? Remember, toddlers don't have one. They're an id. They're a me, me, I. What do preschoolers, the next level of child, understand? So they understand good and bad and a consequence, and very simply, reward and punishment. That's what they understand, the words. In which of Erickson's stages do children begin to think conservation? I try to hit you pretty hard on the theorists here because there's 7, 8 questions. So it's something you need to know the names of the groups. And I think I've described them a little bit easier for you. So begin conservation. Conservation is about the tall glass and the short glass. It's about the organization of clothes and, different items that are be put together, and it's concrete. And the reason why it's concrete is they've had to have seen it, know it, touch it, feel it, smell it before to be able to understand, oh, I can put these different sort of categories. That's concrete, and that's school age. According to Erickson, industry versus inferiority begins at age what? Well, think about what industry means. So industry is my factory, my product. I do it well. I feel good about that. When does that start? And it's ages 6 to 12. As simple as that, ages 6 to 12. Those are the ages. Multi. Erickson industry versus inferiority. Let's give you another one. So it's 2 of the things here. We know Erickson industry versus inferiority is school age, and it's all about feeling competent in what I can do well. That's one of the words they'd use to describe it. And then the other thing is describing it more confidence in the own abilities, taking pleasure in the accomplishments, and people telling me about it. They like the praise. Which is a common sign of stress in school age children? So again, stress can be coming out many different ways. It could be all of a sudden they start to act out when a child never acted out before, or a child starting having stomach pains, going to nurse, things that weren't there before. It's going to tell you that's stress. Another multi. What are signs of stress in school age children that need to be investigated? Okay, bedwetting is that why are they bedwetting? Okay, is it due to stress or they never bedwet before and this is new? Is this something diabetes, mellitus, or diabetes insipidus? Is this a urinary tract infection? It does need to be investigated. School age children normally will regress to early behavior. It is normal. We expect it. So it doesn't need that investigation. The bedwetting is because there could be a pathophysiological reason why they are bedwetting. And that's why that needs investigating. A multi. Safety education for school age child might include school age, the great group of children to teach. And it's everything. We're going to teach them any safety thing that they will listen to. You know, these children are the children that are going to be going latchkey home. You know, nobody's there. They have to learn all of these safety. I mean, and you could go on into more, but these are the major ones: bicycle, water, motor vehicle, and firearms. And if we could teach it, maybe it will prevent one accident. That's all we want, at least prevent one. Dental care typically begins about what age? So you are expected the first tooth around 6 months. My children's teeth never came in till 15 months, but they say by 1 year of age, children's teeth should be in, and we're going to start dental care. How do we start dental care? Well, no toothpaste, just a toothbrush, and you will scrub it. And you also can have fluoride at 6 months old. According to Erickson, trust is to blank as identity is to blank. I'm making sure you understand the categories. So, Erickson, how they respond to other people around them. So, trust is an infant. I call out, are they going to come get me? And identity is all about who am I? That's your adolescent. So, again, practice those. You're going to see things like this. How does the onset of pubertal growth spurt compare in girls and in boys? And we know it's 2 years earlier than boys, usually 10 and 12. And know that the beginning of this pubertal growth spurt, usually it's 2 years later, that menses will occur. What age appropriate activity should be included in the teaching for a 6-year-old child? What's appropriate? Actually, hopscotch should be in there. Jumping rope and hopscotch. Now, what this question is trying to talk to you about is when you give an activity to a school-age child, let's say a child's in a hospital long periods of time, and you need to challenge them to do things, whether playing games or something. The one thing they say is with school age children, you need to give them a task that will challenge them, but you can't give them something they cannot do, that they're unable to finish, because that will give them feelings of inferiority. So they can jump rope, they can play hopscotch. These large jigsaw puzzles, I don't mean like the big pieces, I mean thousands of pieces. If you gave a child a 1,000-piece puzzle, they wouldn't be able to finish it and it would just frustrate them. Why don't we really want them in competitive
Hi,
sports
Nanny.
yet? Because mentally they may not be ready. Okay. How is chickenpox spread? Then you're going to tell me, but we have the varicella vaccine. Well, I've seen many children with varicella vaccine still get chickenpox. So as a nurse, you need to know what to do to protect you and to protect the other people around you. It is airborne. So what do you think you're going to do first if you have a child that's come to your doctor's office or urgent care or something? First thing you do, because it's airborne, you put an N95 mask on you. Take the child, bring them to a reverse airflow room so that we protect the rest of the children, all right? Making sure that they're not going to be inhaling and getting exposed to it. So, chickenpox, a multi. At what point is the child with chickenpox not considered contagious? When can they go back to school? The one thing I've always been taught about chickenpox is macules and papules at all different stages of healing, with a low-grade fever and of course all of that itching, right? So at what point are they not contagious? No new eruptions, no fever, and lesions are crusted over. Itching can occur up to whatever. It doesn't mean that if as long as it's crusted, itching is okay. Which age group characteristically plays with the same-sex peers? So again, same-sex peers, school-age children, what ages? 6 to 12. Culturally competent care includes. So culturally competent care is when you incorporate the patient's beliefs into the care as long as it doesn't interfere with medical care. I mean, I've had blood and chicken heads, and I have had priests dressed up that I didn't understand, all different color robes. It didn't interfere with my medical care. I've seen patients get really better the next day, so I don't say anything about it. If it's something that they believe in, they can believe in it. I don't have to believe in it. I have to give them the opportunity to practice. True or false? Flossing daily is recommended for good dental health. One thing is young kids, age 6 and lower, it's a really hard time to be able to floss. Um, so basically, they need to do it when they're able to. They don't always have that dexterity to be able to floss. A 6-year-old needs to get a chest x-ray. What explanation is best? So again, technician's going to use a large camera, it's going to take a picture, it's going to look inside, and please make sure you show that child what an x-ray looks like and show them his insides. I have found that with broken arms and legs or fingers or whatever, if you show them the break, they have a better understanding of what's going on, why do they hurt, and why do I need the cast, and what to do to make it better. So x-rays are neat. See. Care for a knocked out tooth? So if you have a tooth that comes out on a child, doesn't matter, baby tooth or permanent teeth, doesn't matter. We will try to save both. Put it in milk and get to either the dentist or to an ER that maybe will have a dentist on call. The other thing is they say touch it by the enamel, not on the root. You don't want to put your germs from your fingers on the root, so only the enamel touch it. Which thought process involves logical thinking for the school age child based on the developmental theorists? School age children, the way they think. How do they think? So, school age children thinking, Piaget, thinking he had to have seen it, touched it, smell it to be able to do it for himself. And that is concrete operation. Stage of industry, that is your Erickson. That's what I feel good about. When you talk about thinking, fear is about logic, thinking, it's Piaget. That's I've touched it, feel it, I know it, and that's school age. So then what is the adolescents? They formally can figure it out themselves. That's formal operations. A multi. Erickson's school age. Select all of them. I put it all in one place. They said it in many different ways. So you pick out the ones. So it's a little bit of everything said in many different ways. Erickson's school age, the most tested of all on essays, exams, everything. So that's why I put this slide in here. You know, it's industry versus inferiority. What do those words mean? Okay. And know that it's all about feeling good about what I do well, and that's other people telling me. So that's other people reacting to me. And then the inferior, I feel bad because I can't do everything well. And people, look down at me because I can't. According to Kohlberg's conventional morality, school age children believe what? So Kohlberg, school age children, they're pleasers. They just want to please. Now, who's the reward people? Those are your preschoolers. That's reward and punishment, okay? School age children, they like to follow the rules. They like to do the right thing. They want to please that person. Anorexia nervosa. There was just a couple questions I wanted to put in here to introduce it. This is a eating disorder that can happen in all age children, adults, doesn't matter. And you might be, you know, you might see this. So anorexia nervosa is a eating disorder where they're even afraid of drinking water that has calories. A piece of lettuce is their diet for the entire day, or they exercise overly to try to burn calories. And this child, again, is going to be thin, underweight, and having a lot of problems with it. So that's one of the eating disorders. Which signs may indicate that someone is struggling with bulimia? So, bulimia is the other eating disorder, and they are both, you're going to have a thin child, undernourished. So, bulimia is a little different than anorexia. Bulimia, you eat like a lot of food, but as you're eating, you're vomiting. So this would be a child who keeps running to the bathroom all the time after they're eating. There's a difference. When you have an anorexia nervosa or a bulimic child and they look exactly the same, how would you know one was bulimic and the other one was anorexic? Well, with bulimia, you're vomiting. What's in your stomach? Stomach acid, right? So if you're vomiting stomach acid, you're going to have rotten teeth eventually. So that's usually what you're going to see with that.
You can also look at their hands, usually from where they're sticking their fingers down, their teeth
And
will cut into their fingers.
oh, okay. I didn't know that one. Thank you. I learned something today. Thank you. Which of the following could be a sign of potential child abuse or neglect? I wish I had never seen any child abuse, but I've seen some really severe stuff. And the one thing I'll tell you as a nurse, your job is to protect the child. It's better to have an inspection to be safe than have a child in a situation that they can be harmed or even die in. So, one of the things that we say about a child who comes in that has injuries, when the injuries and the accident, those things don't make sense, it's the red flags go up and it should be investigated. I've actually had one little baby, a 3-month-old, came in with a fractured skull, and it came out that it was the father who had the child and had taken a head in the shower and banged his head on the surround and had fractured his head. Not only fractured his head, fractured his ribs, his humerus, and femur. So, I mean, I've seen some bad things, but when I picked that child up and I felt that head move, I had a sick feeling. And the first thing you want to do is be upset with who brought the child in. Don't do it because it may or may not be that person. And that person who brought that child in suffering because what's going on? Something's wrong with my baby. And anyway, that gentleman is was taken care of, and that baby is safe today. And that's all I know. Cooperative play. What's that? You need to know the plays and who plays the play. So cooperative play, two or more children working together, and then there is a goal. As I said, it could be you finish building the racetrack, or you build a car, or you build a house, or a sandcastle, doesn't matter. You make something. Something is a goal, and you're finished. That's cooperative play, school age. What type of play is considered cooperative play? So there has to be a goal, right? So the goal is playing checkers, somebody wins. When we're talking sharing, that's not cooperative play. That's associative play. Last question. What two common signs symptoms can be found in children that have ADHD? So ADHD is that inattentivity, right? This is the child who can't sit, always moving, never finishing anything. It's that lack of focus, yes. So let's see what we did here. Danny, good job, Danny. Number 2, Diana. We got the D's. Good job. Babs, you did it again. Good job, Babs. And Ellie or Eli and TY, thank you. Okay. All right. Now I have a question for Professor Morris's class. I usually go directly through and don't stop for a break, and you get out a little bit early. Is that something you'd be interested in, or would you like to take a break? Since you're the guest, I'm asking you.
I'm okay with it.
Anybody does not want to just continue? Okay, no problem with me. I have plenty of water. All right, so let's go back to our PowerPoint. We might get done with the PowerPoint and whatnot early, and then I'm going to go over a little bit of math for you, so that you're not so afraid of questions, like Peppered questions and Mike Spicula questions. Want to make sure that, you get all your 10 points. So adolescence, I always say I was a single parent at the time where I had both children as adolescents, 17 months apart, a boy first and a girl. And I said it was a roller coaster ride. You have to hang on, hang tight, and you go through the highs and through the lows with them. And that's what parents do all the time. So we need to be aware that having an adolescent is a difficult chore. It's also a rewarding chore. We know this is where they were babies, they were children. Now, all of a sudden, they're going to be more grown up and then become adults and have more responsibilities that go along with it. It is this rapid physical, cognitive, social, emotional maturation. What happens at the beginning of adolescence? This is that pre-adolescent growth spurt. The secondary sex characteristics are all coming up, and we're having a little bit of a growth spurt at this time. So adolescents, they go through a lot of things going on here. Now, as I said, boys, the first sign of puberty is their testicular enlargement, thinning, and retting. That's with boys. Now, girls is all of a sudden you get little breast buds. It's like, oh, she's starting to mature. Yes, usually 2 years later is when menstruation is going to start. That's usually the key there. The one thing about the menstrual cycles for pre-adolescents, right there at that 12 to 14 stages, they're going to be gaining weight. This 20 to 25% of their weight and height is actually at this time. This is a pretty big growth spurt for adolescents. We had the infants, the big growth spurt. This is that little one, the only other one that they're going to have during their whole life. What happens during that is they're getting so tall and they're losing weight and they're getting moody and hormonal and getting menstruals, and it's really normal for girls to have irregular menstrual cycles, because they're gaining height, they're gaining weight, and it's all that hormones is starting and the menstruation is starting, right? Both boys and girls should get that 3 series HPV vaccines. Now, I mentioned the first thing that you see with children. Now, your HESI and your NCLEX loves to put Tanner stages in there. And it's 5 stages for each. And how do you figure out what do you do to remember 5 stages? Well, if we look at stage 1, that's childhood. That's still a child. Stage 2 is the beginning. So stage 5, they're completely the adult. So there's only 2 stages that you would choose from. What is the beginning stage? Well, that one's easy. But what if they say, when does menarche develop? Or when does the hair start? Or when does the height start? Anyway, it could only be 3 or 4. So Tanner stages, let's make those 5 stages into something that we can figure out. 1 and 5, we know nothing and everything, and stage 2 is the beginning. It's only 3 and 4 we've got to figure out. As I said, there is that adolescent growth spurt, the second time where you have a bigger growth spurt in your life. We have the first year of infants, and now we have this at adolescence. It takes 2 to 3 years for this to happen, though. So it's part of what they're going through, and now they're getting taller and leaner and becoming more looking like adult boys and girls. So Erikson is all about identity. It's all about who am I? It's all about who do I want to hang out with? It's all about I don't like my hair. I have too many pimples. I'm too heavy. I'm too skinny. My feet are too big. I mean, all of this, their identity. That's physical. And then the identity of, am I going to be with the band group, the sports group, the drama club? Who am I going to hang out with? And then beyond that, my role. What am I going to be when I grow up? Am I going to be a nurse? I always wanted to be a nurse. So, what do you want to be when you grow up? Another thing because of all this body image and all of this turmoil and figuring out who I am and what do I want to be and all those things, depression can really, really hit hard. There's really highs and really lows in emotions with adolescents. So if you see or your adolescents talking about their friend, if you see anything where they're sleeping too much or not enough, or eating too much or not enough, or they're pulling away from their friends, they're not going out of their house, or talking about death, take it seriously, because adolescents will commit suicide. We know that their social development is all about the group they want to hang out with, right? That's that big acceptance by their peer. We know that adolescents are going through struggles of privileges and responsibilities, and they don't want to do all the responsibilities to get the privileges, and there becomes this turmoil, and it's moms love their children and dads love their kids, but now they just are not seeing eye to eye. My mother used to say, get that chip off your shoulder, but it's because children are fighting to get what they want. They want to have a little bit of freedom to go out and explore, which they need to, but they need it under what the parents' guidance so that they don't do things and hurt themselves. One of the things that's recommended is if we're having a big issue with that responsibility and privileges and mothers and fathers and children, they're not talking, the school nurse, again, is a great tool to use. Peers, again, important, very important. They're sharing everything about everything. Best friends, do you know how you treat your best friend as an adolescent is how you're going to treat your partner for life. So we can see that, if you have or know adolescents, how do they treat their favorite person? And then, what do they do later on in life? Talking with adolescents and getting a rapport can be extremely difficult. I mean, I am, the older woman, I'm not small woman, and I could be very threatening. and adolescents just don't want to talk to because I'm going to have all of these opinions and I'm going to tell mom and dad. So, the one thing that I do is several things. If a child comes in listening to music, what do you listen to? Have you been to a concert? Who's your favorite? Oh, and if I've heard anything or know anything, I'll remark about that. If they have a sports shirt on, I'm going to mention that. Oh, you like the Yankees? Yeah, I'm a New Yorker myself. Things that helps break it down. Now, if it's a problem where we have to talk about sexuality, how do we do that? Well, let's get the parents out of the room, talk to the child, give them the opportunity to express themselves, non-judgmental, and listen, and know that I don't have to tell those parents what that child told me unless it's something that's going to hurt themselves or others. And again, who's a good person if the parent won't do that? I know my parent wouldn't talk to anything about sex with me. She asked me on my wedding day if I thought about birth control. So, I mean, it's just there's some parents will and some won't, but school nurses can be that person who can help. As I said, immunizations, that 3-shot HPV series can also help with that cervical precancers. Now, nutrition. Well, they had that pre-adolescent growth spurt, right? So they need good nutrition at that time. Doesn't mean they're getting that nutrition at that time, does it? They do what? They grab a power bar, they grab a bottle of water and head out the door. So they're missing snacks, they're not getting what they do need. One of the things, if we're having any age child, especially school age adolescents, if there's a problem, overweight, underweight, if there's a food problem, how do we determine what we need to do? Is a 24-hour diary, food diary. That will always be an answer. If there's a problem, wondering what to do, how to start treating a food problem, we're going to start with a food diary. Adolescents should sleep a lot, but they're not because they're too busy talking with their friends. They have a new boyfriend, so they're talking all night long, or they're getting that project ready because they have to get a scholarship for school and they got to get that project done, and now they're not sleeping. Exercising, they don't have time for it. It's not anything routine that's done. And of course, dental health is recommended because they just got all of their permanent teeth. So it should be dental health and flossing. Sexuality, again, there's so much influence out today that I never saw before. I'll tell you a little story. Do you remember the show I Love Lucy? Old Ricky Ricardo and Lucille Ball. It was one of the first sitcom type things. When that show came out, they showed a picture of the bedroom and it had 2 single beds in it. The public had an uproar. How can you show a bedroom on TV? Look at today, the difference. We're seeing everything that happens in the bedroom. So everybody's being exposed. So again, we do need to be aware of that and be, as a nurse or as a parent, be there to give the information that's factual, not just what they're seeing. And again, parents should be there, if not school nurses. And if Planned Parenthood's still around, that should be used too. Now, safety promotion, injury prevention, number one, biggest injury, any age child, infant to adolescents, motor vehicles, number one. Adolescents now are driving, and now we've got, that as one of our related injuries there. Then it's firearms. The other vehicles, remember, ATVs, they can't be under 16 years old. And then we have the injury with sports. Remember sports injuries. what are children doing in high school? Many of them, they're trying to get scholarships, sports scholarships. So they are pushing themselves. So they're bigger injuries, right? So we need to, at all costs, prevent the injuries with equipment or warming them up or whatever. So Matt is 14 years old. That's the beginning of adolescence, right? That's that pre-adolescent growth time. Seems to be always eating, although his weight is appropriate for his height. The best explanation is what? Remember, he's putting on 20 to 25%.
A.
Yes, it is. Remember, that's where he's putting on all of that weight and height. So when you're growing, just like that infant, you're eating, 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 eating. You're trying to keep it up. You're trying to feed that fire. Very good. All right, let's go to our Kahoot. Nope, sorry. Iana, could you come on camera, please? Miss Johnson. Miss Johnson, can you come on camera, please? Does anybody have her phone to text her to tell her to come on, please? I'll ask her again and I'm going to have to remove. Iana, are you there? Miss Johnson?
Yes, ma'am, I'm here.
Okay, please put your camera on. Thank you.
Sorry.
I was just about to remove you from class and I do not want to do that. So thank you for being here. All right, let's go. Who wants to win this one? Babs, are you going to do it again? She's hard to beat, guys. She's practicing these. Adolescents. There's not too many of these. About 17, 16. Erickson's identity versus role confusion. So, adolescents, we're all about identity. I think you have put this into your head enough that you're going to remember industry and identity at this point. When is adolescents need to establish their own identity and to form values to live by? This is when. What's the name? Adolescence, identity. It's right there in the question. And it is identity versus role confusion. Who am I and what I want to be? I never want to be an adolescent again. In the identity versus role confusion stage, adolescents, what? So in identity versus role confusion, they search for the identity of themselves and their personal identity. Now, Freud is the one that says try to form intimate relationships with other people. So we know anything sexual is Freud. What age do you have to be to drive an ATV? So, to drive an ATV and to be safe, it is recommended 16, according to the book. Since surviving a sexual assault, she startles easily, feels numb emotionally, and has flashbacks. Her symptoms resemble what? I mean, this question is telling you a couple different things. These children, these need to be treated, with that sympathy and empathy. Also, remembering who brought that child in to be examined following a sexual assault. If if this is part of it, remember those people are going through a lot of suffering too. I mean, especially if I had my daughter with sexual assault, I'm bringing her in for treatment. I'm going to feel pretty horrible. So always remember that person also. Many victims experience emotional and blank reactions from rape and sexual assault. It's all emotional, psychological, and it lasts for their lifetime. It does. It's only how to deal with it. Which of the following are false about the HPV vaccine series? I remember when my children turned 12 is when they first started recommending this vaccination, and the schools wanted them before they went to school. It's many years ago now. Now, HPV vaccine, if you give it at 12, they say you can do 2 vaccines. If you wait till over 15, you need to give 3, is what is said. But they're saying it's a 3 series vaccine, and that's what we will call it. At what age should a parent expect to have major conflicts over independence and control with their child? So they've gone through their pre-adolescent growth spurt. They're taller, they're bigger, they're more mature looking. And now I want to do what I want to do. All of that privilege with no responsibility, right? And that's about 15 to 17. So remember, pre-adolescent growth spurts at the very beginning. It's that 12 to 14, 15, okay? So that's where all of a sudden they feel they need to be able to do more. What Tanner stage marks the onset of puberty in most males? So, Tanners, when we are onset of puberty, that is stage 2, boys or girls. Remember, 1 is a child, 2 is the beginning, 5 is the end, okay? That's how you're going to have to figure out what stage they're looking for. Onset, we know it is stage 2. What marks the onset of puberty in girls? So that's the stage of menarche, right? Puberty. What is the Tanner scale used for? So Tanner's scale, it measures puberty, sexual maturation. It describes what's going to happen, and adolescent medicine uses this scale a lot. Major causes of death and injury in adolescence is and motor vehicle, automobile, absolutely. Thank you. True or false? Sex education for adolescents aims to provide information to adolescents about issues related to sex. Absolutely. Now, can you have an adolescent girl without parental consent? Can you talk about birth control with her? Do you think so? The answer is absolutely. You do not need a parental consent. You may. You can give written and oral information, not your opinion. How can you get an adolescent to be more receptive to talking about their health and sexual exploration? The one thing I can tell you, when you get this child, this adolescent in a room alone and you're talking, be prepared because sometimes they're going to tell you things that they're going to see if you're shocked by what they tell you that they do. Just be prepared for it because they will. When you want to talk about sexuality, a lot of times having the parents leave, you're going to get a very honest answer, and then you can better treat the child. And that's why we have the parents leave. True or false? Keeping a food diary is the first step of treatment for an obese child. Any age, infant to adult. Absolutely. Because if you're overweight or underweight, the reason is why. And is it because of simply what you're eating? Then you go into looking at some sort of pathophysiological reason why you're too much or too little. But the first thing is let's look at what you're eating. Last question. A multi. An adolescent has been brought into the ER with a drug overdose. What is the initial questions you need to ask? So when we're talking about adolescence and we're talking about a drug overdose, what's important to know? Well, I need to know what you took, when you took it, and the route is very important. When you take it IV, it's in and out quick. If you took it orally, it's going to last longer, or nasally, it's quick. So that's important. We don't talk about rehab yet. First, we need to treat the overdose. Number 3, Bailey. Good job, Bailey. Number 2, Danny. Good job, Danny. Number 1, drum roll, Diana. Good job, Diana. Eli, and oh, thank you again. You're welcome. All right, we have a little bit of time. I have a question for you. Would you like to do math, or would you like to do a little bit of an exam review?
I like the sound of the exam review.
Exam review.
Review.
Exam.
Look at that. All right, we'll go over those quick type things. I have time. I'm going to use it for you. If anybody have a chance yet to listen to my review? All right.